Afternoon. This question primarily for the minister from my colleague Shannon Patterson, and this is around the idea of making vaccines mandatory or maybe a requirement for certain settings or jobs. So once a vaccine is available, should people who work maybe in healthcare and long-term care be compelled, whether legally or otherwise, to get vaccinated as a condition of employment, or what's your vision for how this might work?
So I will actually take that on because that is something that is part of my area of focus for many, many years. So we have no mandatory immunization programs in this country and in this province, and we do not expect that COVID immunization will be mandatory either. Having said that, there are some key positions where we know the risk of transmission in long-term care, for example, in some healthcare settings, can be very high. So we will be strongly encouraging everybody in those settings to be immunized. And if people are thinking of going into those settings and don't believe in immunization, then they should look for other things to do. But these vaccines are going to be, I have full confidence that these are going to be effective and safe vaccines when they are ready and approved for use here in Canada. And I know that we are waiting for these, particularly in those areas where people are most vulnerable, and we can protect people very rapidly using these new vaccines that will be available very soon, hopefully.
David, do you have a follow-up? Oh,
I
sorry.
do, Dr. Henry.
No, sorry, just...
We had this discussion, I think, 1 year and 7 or 8 months ago about this question around measles immunization. And what has proven effective is engaging with people, and that's what we're going to do in this case as well. I think it's nice to talk about a situation of broad immunization, and we're looking forward to that. Initially, we're going to get the vaccine that we get and make the decisions based on public health advice required to deliver that vaccine. But we'll be providing lots of information for people and support for people because, and the way to do that is to engage, is to educate, and to involve people in those important decisions. And we're not just doing that because we believe that's a good thing to do or the morally right thing to do, but it's because it's the effective thing to do. And Dr. Henry, who's worked her life on this, will tell you that. People in public health will tell you that, and that's why we're going to continue to do that. So I don't think you'll see those kind of rules put into place. What you will see is for vaccines that I believe will be proven safe, you will see an effort to engage with people and to give people the information they need so that they can feel safe when they get immunized.
David, do you have a follow-up?
I do. Dr. Henry, a Vancouver pop choir has gone virtual. They've done a creative and catchy rendition of All I Want for Christmas Is You. They've turned it into I Will Social Distance With You. So one of the lyrics, I want to hear your lovely tone, but only over Zoom or phone. You know what's coming. This is for the minister, too. I'm not going to ask you to sing, but I do want to know this. In the spirit of the serious message of what the members of this choir are trying to convey, Dr. Bonnie Henry, what do you want for Christmas?
Oh, vaccine? I want this to be over. You know what? I've heard that, and thank you for not asking me to sing because it would be horrific. It's not one of my skills. But I think it's a fabulous choir, and I have seen so many wonderful words of support and people engaging in this, and we need to have that joy and that humor and that in our life through this hard time. And so what I want for Christmas is everybody to stay home with their family and stay safe so that we can get through to the next year.